Hi, I'm Carly Ross. I'm a student nurse, and I'm going to do my newborn assessment on this baby, Delilah. Um, she was born 12 hours ago vaginally. Before I do this, I've already washed my hands, and I would be wearing gloves for this procedure. So the first thing I would do would just be to look at Delilah and see, is she fussing, is she crying? And which she's not. She's pretty chill. She's sleeping. I would check for signs of respiratory distress, that she wasn't inhaling too much, like I couldn't see her ribs inhaling. I couldn't see her nostrils flaring. Any signs like that. All of her limbs are nice and pink. Her face is nice and pink. Her lips are nice and pink. And so her color's good. Her posture's flexed, just like a normal baby would be. Her head proportion, I'm going to check it out, and I'm actually going to measure her head circumference. And I'm going to, sorry, it's really hard to do, sorry, Miss Delilah. And her head circumference is 12 inches or 30 centimeters. And her head is about 1/4 the size of her body, so it's pretty proportional. Most babies have pretty big noggins. And so she has bilateral movement. I saw her earlier and she was moving everything normally. And her skin is clear. There's really no swelling. She was born 12 hours ago, so there's no swelling. I'm not seeing any erythema, so I'm not seeing any redness or swelling, and obviously no stork bites. And so I'm going to listen to her respirations, which normal would be 30 to 60 breaths per minute. And so I'm just gonna feel for her respirations, and I would count for 1 minute. So I'm gonna listen to one for 1 minute. Okay, and her respiratory rate was 36 breaths per minute, which is normal, which is in the normal range. And now I'm going to listen to her heart rate and my stethoscope. I would usually use a Pete stethoscope with her, but or on a normal I would use the bell, and this one has a bell setting, so I'm going to use the bell setting, and I'm going to listen also, and it should be between 100 and 160 beats per minute. So I'm going to listen also for a minute here. Okay. And I heard her, I did hear the loved up sound, and I did hear 120 beats per minute, which is normal. And because she's a relatively healthy baby, I wouldn't actually take her blood pressure, but the blood pressure would be about 60 to 95 diastolic and 30 to 60, switch that around, systolic on that first one, and then 30 to 60 on diastolic. And then I already checked on her circumference of her head, And then I would just look for her head and see that her sutures, the suture lines haven't, because she was just born, her suture lines haven't conjoined yet. And the fontanelles, the soft spots on her head are still there, so we have to be really careful with her. And then she has blue eyes, and her pupils, I'm going to lift her up so I can see, and her pupils are round and equal. And then her ears are both in line, and the top of the ears in line and straight. And her nostrils are not flaring. Her nostrils are patent. She is nose breathing. And her mouth, her lips are pink. She has her mouth open right now because she's kind of looking funny at me. And I'm seeing that when we do the reflex, she does turn her head to look for it and tries to suck at my finger. And then I'm going to check on her chest, and her nipples look straight in the right spot, and I'm going to measure her chest, which is 4.5 inches or 11 centimeters. And I'm going to listen to her bowel sounds. And yet again, I would listen with a Pete stethoscope. So I just want to hear if her bowels are making noise. Because after she's already had her first meconium, her first poop. So I would listen here at the bowels in all the 4 little quadrants. And just hear that they are gurgling, they are making noise. And next I would just check her extremities, make sure that she does kick me when I touch her feet, and her arms are both moving bilaterally, and she can hold my fingers. And then I would check her back. So I'm going to check her back and just make sure that there's no obvious signs of issues, and her back looks clear, there's nothing wrong. And then I would check her butt and her genitalia, which I would do, and I would just assess that they are in the correct spot. They all look normal. And then that I would make sure to wrap her back into some clothes so she can stay warm, and I would write down my findings.